I'm very pleased, though, to once again introduce everyone. First, I'd like to say welcome on behalf of the University of Michigan Center for Disability Health and Wellness and the Michigan Model Systems. This presentation is brought to you by those two entities because we really do think it's important to see and hear about individuals with disabilities living their lives and thinking about what each of us, and particularly what healthcare providers, can do to address disparities, to get what we need to learn to get informed. But more important, what individuals with disabilities need to see to know that it's okay, that you can be parents, that anything is possible. Anyway, I'm very pleased to be introducing a wonderful panel. Of course, we have Dani Izzie, who is the founder of Access Social Limited License Corporation, as well as a founding member of Profound and the star of this documentary. Dr. Brandy Bentley is a research fellow at the University of Michigan Center for Disability Health and Wellness, but she's also a doula in the community. And her research focus is on women with disability and pre and postnatal mental health and wellness issues. We are pleased to welcome Dr. Miriam Barry, who's a clinical assistant professor and physiatrist with a specialty in working with individuals with spinal cord injury here at Michigan Medicine. Ms. Tamika Sishan-Spruce is an advocate and filmmaker and the director of the lead-in program for the Michigan Disability Rights Coalition. Dr. Susan Ernst is the chief of gynecology and sexual health at the University Health Service and the medical advisor for the Sexual and Gender-Based Violence Program at Michigan Medicine. And I am Michelle Mead, your moderator for this process. We'll start with some of the questions you have, but I know we have many ourselves. So, Sarah, were there any particular that you wanted to present? So throughout this discussion, you'll be hearing from the individual facilitating this whole production, Ms. Sarah Turner, who will share some of the questions that come up.
Yep. Thank you. So yes, we have a couple of questions here already. So we have one that I mentioned before about if the film is available for purchase. And then we have a couple more. So why don't we start there?
Dani, is the film available for purchase?
Yes. Hi. Hi. I think you recognize me from the film Mother of Lavinia and Georgiana, and star of Dani's Twins film, and also an entrepreneur and business owner. As for the film, yes, it is available for purchase. You can watch it streaming online. You go to danistwinsfilm.com, and there you'll find a link to Vimeo, and you'll be able to do pay-per-view and watch it on Vimeo.
Okay, so I have to ask, at what point did you decide I want to do a film on this and I want to share my experience more than just what's on my blog?
I didn't really want to share anything at all because I'm a pretty private person. But then my friend Brad, sorry, my dog is sorry. My friend Brad, who's a filmmaker, actually approached me, and he does documentaries that are social impact focused. And I thought, okay, I might be able to have an impact here. And there's hardly any stories out there in the media and television. So maybe my story can change things and help people. So at that point, I had somebody I trusted that I could work with. Brad is one of the directors of Dani's Twins, and I decided to just go for it.
And I know while we were there, are a few of us here, and the statement was really how many of the things that were highlighted were so impactful and so important, not just for other women who were pregnant and thinking about having kids or going through this journey, but for anyone coping with a disability and adapting after something like a spinal cord injury.
Yeah, absolutely. I mean, I think it's just, I think the fact that I had twins too is very encouraging to people that just want to have one baby, because I think it sort of gives them courage, right? In a way.
Mhm.
I mean, so many of my friends in my support groups are asking questions about having a baby. Is it possible? Can I do it? Can I juggle it with this very challenging lifestyle that, that we have? And I'm kind of like, well, I thought I was going to have one. I ended up having two, and here I am. So really, like you said at the beginning of this, anything is possible. Of course, if you have great doctors around you to support you and facilitate your journey to parenthood, even better.
And so I know where there are many questions, but I wanted to start by asking, you had mentioned, not how do I parent despite the spinal cord injury, but what strengths or particular things do I bring in as a woman with a disability, as a woman who's had to learn to problem solve, to, find my own strength, to redefine my life?
One of the things that Dr. Fuller from the film said to me was when he first brought me on as a patient was, Dani, you're already prepared for this. And, he knew what was ahead, like a pretty high risk situation with multiples and my disability. And he said, you're already prepared, and looming parenthood, right? He said, you're already prepared for this. I think as people with disabilities, we are quite resilient because of the day-to-day challenges that we face, not just coming from our body, but from outside of our body in society, and ableism, and policies or discrimination, things that just don't help us, right? So there's this kind of built-in resilience, I think, and that goes a long way in tackling pregnancies, which can sometimes be difficult, or even the challenges of parenthood.
Mm-hmm. I want to sort of go and ask some of the panelists to reflect on two of the things that you really talked about there. The first is the ableism issue and how that impacts with the parenting, and then just being prepared with this. And so either Tamika or Brandy, what has been your experience, either from research or working as a doula, or personally as, an advocate and leader in this area, Tamika?
Yeah, so what I would say, I have two children as well. Um, they're not twins, but a similar situation. They were born less than a year apart. So growing up, raising them was similar to like having twins. They 11 and 12 years old right now. But so yeah, we're raising them. I'm sure Dani probably has the same experience that, the stares, the people looking at you, people making comments, people came to me like, who's helping you? Or, they want to give me and my children money, and buy them things. And it's just, it's a lot of ableism, definitely from society and things, because they do wonder like, well, how can you raise a child and you use a wheelchair, you have a disability? And so, I try not to let that affect me too much. But it's hard, when it's constantly happening to you. when you go out with your children. So
And so I'm hearing that importance of the emotional boundary. And I reflect, really think about what you said in terms of, I felt so good telling my doctor, the dentist, I don't feel like answering that what you do, you really owe other people with this.
Yeah, and that was really empowering. I think that's what it means to suddenly sort of, when you really become comfortable with the disability sort of identity, you accept it, or you at least see it as something that can empower you, not something that other people interpret as your weakness, right? So being able to flip that on its head is really empowering, and then being able to draw those boundaries when you do encounter ableism or just bad manners. It's a wonderful sort of growth. It was wonderful growth in my personal journey and in my sort of emotional understanding of being a person with a disability.
Brandy, what have you heard either through your work as a doula or through your research?
Yes, thank you, Dr. Mead. I am deeply moved by Dani's sentiment on how it's so powerful and important for us to be interdependent on one another, and the strength that's garnered when we rely on each other and support one another. And I think, especially in my role as a doula, supporting families emotionally, physically, and providing them with extra resources and support, it's just something that repeats itself over and over in my work. And I think having that extra support and advocacy and someone that can support you in empowering, making empowered and informed decisions can make such a significant difference across the perinatal period, and just knowing that you're not alone and you don't have to do these things by yourself. And I think, similar to what others have said, just increasing our awareness and making it known that individuals can do whatever they want, and disability may have limitations, but folks are still empowered in their decision making. They're empowered to make choices that best support them and their families, and making sure that we're aligning with communities in a very powerful way to uplift their choices and decision making throughout this process is super important.
Thank you. I guess, what do you actually find though when it comes to healthcare providers? It sounds like you found a wonderful team to work with you. A lot of folks aren't that fortunate.
Yeah. So before I found my healthcare provider, I was worried because I talked to my community. I investigated and I found so many heartbreaking stories from women. I run a support group online, by the way, called Quad Squad, and it's all women with quadriplegia. There's about 500 of us. And there were women in there that said that they had people who were pushing them, either people in their personal lives or, unfortunately, doctors, telling them, really encouraging them to get their tubes tied, or to not pursue having children. So they weren't getting that kind of invitation, that permission, that support that sometimes we're looking for, because we're constantly told that, like, you shouldn't do this, you're not equipped to do this, you're not competent enough to do this, so we need those people on our side telling us, yes, you can do this is a possibility for you. The reality is there are so many people with disabilities in the world, and they have babies all the time. And so it's the jobs of people, especially clinicians, to understand that reality, right? And I'm so lucky that I found Dr. Fuller and this team that I had down at UVA. And it was a high risk, or a maternal fetal medicine clinic. So I think they're used to dealing with moms and dads with disabilities and babies with disabilities. So that probably helped. But I do realize that I did have a very positive experience. It's not always the case for everybody.
And I want to bring in Doctors Ernst and Barry now and get their perspectives in terms of working with women with disabilities and teaching residents and other providers. What do you both face in terms of training people? And then what's the clinical issues that you find that come up or that are most challenging?
Dani, I'm Dr. Susan Ernst, and I've run a reproductive health clinic for adolescents and women with disabilities for the last 18 years. And I'm so glad that you shared your story, because I think other patients will benefit from this positive experience that you had. And I think it was very real, the way that you showed your pregnancy and delivery and postpartum period, not just highlighting the positives, but also showing some of the challenges. And I want to say that in 18 years of caring for women with disabilities and doing research, I have heard so many stories about women who don't experience respect in their clinical encounters. And it's really frustrating to hear this over and over again. I had a woman tell me that she was someone who had lost her sight after infection in her eyes when she was young. And when she became pregnant, she went to labor and delivery for her delivery. And one of the nurses said to her, "How could you do this to your baby? You're going to pass on this disability to your child." And she said, "You're the healthcare provider and you have no idea what you're talking about. This is a horrific thing to say to someone who's coming in to deliver their baby." And so one of my goals or missions is to educate healthcare providers about healthcare disparities for people with disabilities, and how part of those healthcare disparities exist because of stigma in our culture and the inappropriate treatment of people with disabilities in the healthcare setting. So I don't know if I spoke too much or too little, but I can answer more questions later. I'm going to let Dr. Berry speak as well.
And Miriam, can you introduce yourself and what your background or specialty is?
Yeah, absolutely. Hi, everyone. I'm Miriam Berry. I'm a spinal cord brain injury certified rehab physician. So most of my clinical work is around patients with a lot of neurological disorders. And, the question was essentially, personal versus clinical experience. And I really wanted to highlight the merge for me. When I became a parent in 2018, after I gave birth, I looked at my academic record and I just thought to myself that this lived experience right now should be at the top of my CV header, because the resiliency and the amount of juggling education I have to do while maintaining my job and maintaining interdependence in my community was remarkable. I'm like, how come we don't talk about this all the time? So it made me think a lot about my patients who are postpartum, who are, in the ICU now in rehab, who are breastfeeding, who are trying to have their baby latch, who are working with our therapists to triage fits, how to hold a baby, how to change diaper, how to make sure they're strapped correctly while I'm in a power chair, et cetera, et cetera. Within this enormous dynamic, this lived experience of mine opened up this chapter in my life where I dedicated a lot of my research to lactational outcomes in patients with neurological disorders, disability. There's 3 major guidelines coming out in the next year or so, because we know that there's such a deficit of education. So that's what we do. What we do is we utilize our lived experiences and making sure that we're teaching our house officers, our nursing staff, our therapists, talking about sexual health, talking about pregnancy planning, pre-pregnancy planning, postpartum, which is essentially 5 years, honestly. If you were to ask me, it's forever. And it's things like what we're doing here that kind of allow us to open the channels of thoughts and feelings, and having our lived experiences together is what makes us essentially stronger. But that's my little deal. Let me know if you have any questions.
And I think there are questions coming in from the audience. So Sarah, do you want to read 1 or 2? And then we can go
Absolutely.
back.
So I'm going to start. So one of the questions is, how are the twins doing today? How old are they now?
They're amazing. They're hilarious. They're 3 turning 4 on April 24th. Yeah, they're joy.
That's wonderful to hear. So I have another question that is kind of on the same theme. So can you share more about how your family supported you during your journey?
Well, as you guys saw in the film, my kid, so let me just step back 1 second. When I signed up to do the film, it wasn't the pandemic. Trust me, I would not have embarked on that during the pandemic. So I didn't know what was coming. The pandemic happened. I had my babies April 2020. So that was like right when it was intense lockdown. And I'm high risk. My lung function as a quadriplegic is at 30%. You know, I can't afford to get pneumonia or any kind of lung compromise sort of thing like that. And the babies were straight out of NICU, and as well, their lungs were still developing. So we were, unfortunately, we were like no contact with anybody. It was me and Rudy, baby boot camp, and it was rough. It was really rough because my plans kept flying out the window. I had a plan for 1 baby, flew out the window. I had 2. And I had a plan for how I'd take care of 2 babies, flew out the window because that plan depended on having help, having assistants coming in the house, rotating grandparents help, you know, siblings helping us, food trains, none of that happened. So it was truly an exceptional situation that you know, hopefully it's not a common experience for most. And hopefully if I ever do have kids again in the future, I'll really be able to have more help. So,
But I also want to reflect on how you said, here was what I had hoped to happen. I thought would happen, that I could be independent, that I would be able to breastfeed, that I would be able to always change their diapers or to do everything, do the caregiving independently. And then there was the reality. And,
yeah,
you know, you folks in the room reflected about that. There is, for all parents, I think, a switch from here's what I expected or wanted, and then here's what life throws or how I've had to figure it out.
yeah. And I think for someone who has an acquired disability like I do, I acquired my disability 15 years ago, and I kind of revisited those early days where I lost my independence and I had to like go through this dark period where I was like, wow, I just have to let that go, you know? And having the babies with me at home, it was sort of the same thing. I was like, you have this deep instinct as a mom to do certain things for your newborns, right? And I just couldn't. So there was this period of like grief, really, to come to terms with that. But you know, also kind of thinking of that idea of interdependence was really helpful for me. I actually came across that idea from a disability justice well-known spokesperson. Her name is Mia Mingus. And she wrote about something called access intimacy and interdependence. And she said that independence is a myth, right? People make our clothes, mass transit systems. Like none of us are truly independent, but I think as somebody with like an acquired disability, especially spinal cord injury, it's like drilled into your head, and you drill it into your own head that you have to be hyper independent. And it was so freeing to kind of let that go and be like, wait a minute, I'm holding myself to really unrealistic, mythical standards. No, I don't have to be that level of independence. It is okay to depend on others to need help. It's actually natural, right? So kind of realizing that was a growth moment for me as a person and a mom too.
Dr. Bentley, anything there that resonated with what you've seen in communities or what you've heard?
Yes, yes. I think just further uplifting that ideal of we need each other. I know within my community it's commonly stated that it takes a village to raise a child, and we extend that belief to every step of the process. So pregnancy, childbirth, and parenting should be processes. Life in general is a process that takes all of us supporting one another. So that definitely resonates.
And Tamika, was that sense of grief different, or that emotional reaction to the pregnancy and the parent different for you, having lived for a longer time with a spinal cord injury?
Yeah. Um, yeah, I would say that the grief wasn't as much as there because, yeah, I acquired my disability as a baby. So, there was like growing up because of the society that we live in, there was concerns growing up, like, can I have children? What would it be like being a mother? And, those type of things, and how, the image of what society says what you're supposed to do, as a mother, compared, it does vary differently when you have, a disability. And so, and I like what Danny said, the interdependence and being okay with, asking for help and, just letting go of societal standards of what, motherhood or, what pregnancy is supposed to look like. So even though I did not experience the grief, I did have to be okay with, what motherhood looked like to me as a person with disability.
I have someone here who came to watch in person, and she has a question. So I thought it's easier to ask her to just one.
Hi, Dani. Thank you for sharing your story. It was really very heartwarming and actually inspirational. I really do hope we can get our residents and our fellows to actually see your film, because it really brings home, we're all trying to provide care for people with spinal cord injury. My name is Gianna Rodriguez, by the way. I am one of the spinal cord physicians here at Michigan Medicine. So as a good question for you, I've had a number of female patients who've had children, and they've come up with like different ways, devices or modifications to like equipment or devices that have helped them with childcare, whether it be a baby or now toddlers. Like for example, like you mentioned, changing diapers or feeding or whatnot. I don't know if you've come up with your own. That's the first question. And number two, or if you've found, good resources that you could share, whether it be websites and things like that. I know there are a number out there, and you kind of have to sift through what really does help. So, so that's my specific question.
Thanks.
Thanks.
Yeah, so I did come up with a lot of stuff, and I really enjoy like pretending to be an OT, and like coming up with these things. It was really fun figuring out like what gadgets I could use or what things were accidentally disability friendly. For example, like the magnetic onesies, they cost a fortune, but if you can get them, they're really way better than the snaps if you have any dexterity issues. And I even have my mother-in-law, I think it might be in the film, but she's helping sew some magnets into some of their clothes. We kind of had made our own DIY magnetic clothes so that I could, be able to enjoy at least trying to get them dressed. even with all the gadgets, it was really hard to get them dressed. But yeah, there were a lot of solutions that I came up with. But what I found out was that a lot of times I didn't have to spend a lot of money. I think all women, like, are parents, I should say, sorry, and all birthing people, like, we're thrown all of these like ideas and gadgets and gizmos. And it's actually a lot simpler than that. Like, for example, I was looking everywhere for a baby changing table that was adaptive. And in my mind, I was like, there's got to be something out there purpose made for people with disabilities or who are in a wheelchair that need to roll under. Because all the baby tables are like, it's usually a spot on top of a dresser and you can't really roll on it. You can't really reach it if you're in a chair. I was like, I'm just going to put the mat on a table. Like, well, I'm overcomplicating this, you know? And that worked perfectly fine. Or I'd put the baby on the bed. And that was more at my level. And I was able to do it that way. So I didn't always need a gadget, or sometimes the answer was right in front of me. But I would say OTs, even though I didn't get to consult with an OT, OTs have that creativity. And I think, you know, it's really fun and worthwhile to work with an OT to figure some of that out. As for resources, those support groups I mentioned, a lot of there's just, you know, people who have had the personal experience. They have a lot of ideas. I mean, I had women that had some hand-me-downs for gadgets that they sent me, and that was really helpful. I made a couple resources on YouTube that I could send you later.
Cool. That will be very helpful for, you know, for.
Great.
Thank you.
And I know there are many other questions. I know most of them are aimed at you, Dani, but I want to also, you know, ask you to share, but also ask others who may have different types of experience associated with it to also chime in. So, Sarah?
So I have a couple more questions. So one is for Dani. If you ever thought about moving to a more urban situation?
No. I like where I've lived in urban situations. I grew up in an urban situation. I like the country, and it's great for my kids. They get to run outside and be in nature. We have a wonderful daycare nearby. It's safe. I love it.
And are you farmers? No? Okay.
No way. My husband's a salesman and I'm
Okay.
in marketing. So we're the furthest from farmers you could ever imagine. We just like nature. It's
Okay.
slower lifestyle.
I just, many of the farmers we encounter are also great problem solvers. And so those overlaps.
That makes a lot of sense.
So
I
really
will
well.
say though,
Mhm.
being rural was tough for getting to UVA. We're about 45 minutes away. So that was a little dicey, as you said.
I have one more question. So this actually was originally for Dani, but I think we can probably expand it to more of a clinical question to make it a little bit more general. So somebody was wondering if pregnancy changes bladder or bowel management programs.
Do we want to start, if it's okay, Dani, from the clinical
Yeah,
perspective?
I was going to say, I would love to hear the clinical perspective. I can say yes, I can explain really why.
Yes, we definitely see a lot of changes as the uterus enlarges. There's a noxious stimulus on the bladder. Sometimes the medications the patient might be on is not compatible with pregnancy. Sometimes patients have treatments that they can't continue during pregnancy, such as like Botox to the bladder, etc. So yes, bladder does become an issue and becomes a stimulus for what you had described of the autonomic dysreflexia, or the fluctuation of high blood pressures that you were seeing. And it takes a multidisciplinary team to get that under control. With bowels, a little less dramatic. Usually we see constipation. Depending on body habitus, we may make adjustments in terms of the types of suppositories we're using or the types of laxatives we are using that are just much more friendly in the setting of what the OBGYN believes is much more friendly for the bowel management.
And
I was just going to add that urinary tract infections are not uncommon in pregnancy in women with spinal cord injuries. So it's something that we monitor for and treat when they're symptomatic. And then the other thing I was going to mention, Dr. Berry already, said the different changes with the uterine growth and pressure on the bladder. Sometimes women with spinal cord injuries may need as the uterus grows, catheter placed or intermittent straight catheterization if they weren't using that prior. I think that's all I was going to add.
And are there any wellness activities that you encourage for your pregnant moms?
Yeah, well, we always encourage exercise. Now, for women with spinal cord injuries, we would still encourage them to be active. For women like Dani, you mentioned that you have decreased respiratory function. And so in those cases, we would want to check pulmonary function tests early and then monitor that over time. As the uterus grows, it decreases that respiratory capacity even further. And so that's something that we would need to monitor. But yes, we always encourage women to remain active while they're pregnant.
I'll just chime in and say, for me, I don't think in my situation I could have handled much like aerobic or cardio just because my blood pressure was so low. I literally could not. And if I had tried, it would have been too much because when I get that really low blood pressure, my heart is racing. And I do have trouble just like getting good breaths. So I think that would have been too taxing for me. But so what we did, my husband, you saw in the film, there's a part where he's doing range of motion and stretching, kind of gentler body work, which was really helpful because you get less and less mobile. I'm already not that mobile because of the paralysis, but you're less and less mobile with the pregnancy. So that was crucial. I would definitely say, like, I think, my spine kind of changed a little bit with this pregnancy. Definitely, like, my rib cage changed shape, and so I think it's important, if you can, to do at least that gentle body work.
Dani, I'm glad you brought up the blood pressure issue because it was talked about a lot in the film and it's really complicated. So women with spinal cord injury can have a lower baseline blood pressure, but those who have injury above T6 can have that autonomic dysreflexia where noxious stimuli can cause their blood pressure to spike. And on top of that, women who are pregnant are at risk for preeclampsia, which causes elevated blood pressure. So it's just something that I'm sure in your pregnancy, you had to monitor your blood pressure very closely. And at every visit, watch that blood pressure, check for protein in your urine, because that helps us to determine if elevated blood pressure is related to preeclampsia or if it's related to autonomic dysreflexia. So I was glad that you mentioned that in the film, and it is really complicated.
I'm so glad you brought that up because it was something Dr. Fuller brought up too. Like, I can experience autonomic dysreflexia too, but I was also at risk for preeclampsia. So one of my questions for him was, how do I know which one is which, and what happens if I get a double whammy? And so it's just great and so comforting to know that the experts really understand the interplay of all these complex sort of layers.
And I think that may be where I try and work to tie things up. We only have about 2 or 3 minutes left. And so for me, what I'm hearing is really just women with spinal cord injury, with disabilities, parents, individuals with disabilities in general, knowing that, you have a right to be a parent. This is an honor, a privilege, a joy. Being a parent, though, is complicated in itself. That you can use the skills you've developed in part in dealing with disability and apply it to these situations. And one of these, especially during this time, is going to be how to partner, how to find and partner with healthcare providers who are going to listen to you, and who are going to work with you. I'd like to ask everyone to just say a final word, if that's possible, and then Dani, I'll give you the last minute. So you start with Brandy. Any final thoughts?
Yeah, I would just say keep sharing our stories and increasing awareness, decreasing stigma, and letting people know that it is possible.
Thank you. Susan Ernst?
I agree with Brandy. I think many women with disabilities or spinal cord injury are told you can't get pregnant, or that's too dangerous. And I think when we think in a framework of reproductive justice, each individual gets to decide when they want to get pregnant, if they want to get pregnant, or how to prevent pregnancy. So it should be an individual decision. And I think this is really helpful for women to see a positive story about choosing to be a parent and making that happen.
Thank you. Tamika?
Yes, same thing that as everyone else have said, that you have a right to be pregnant and make those choices.
Marion?
Yeah, and you have the right to be heard, and you have the right to be not okay with what is being said. And, just know that the resiliency that you have in the setting of what you built up from this disability is paramount and strong, and you should utilize it. Because what struck me, Dani, is when you said that you need to be strong so you can pass on your strength to your daughters. And that's in action, and that's in thoughts. So thank you for sharing.
And Dani, any final things you want to leave the audience with?
Oh gosh. Well, I'll just say I'm really, even though when I started this journey with the film, I was hesitant, but now I'm so happy and grateful that I've been able to share it with so many people, and I'm particularly happy when I can share it with, well, other disabled individuals, but clinicians too, because I think it's really important to understand sort of the social sort of background to what it means to live life with a disability. It's not just a medical condition, it's also a lifestyle, and not necessarily a bad one. So it's a privilege to be able to share the story, and I hope it inspires people to share their own stories, because it's very powerful.
Thank you very much. And thank you to all the panelists for being here tonight. Sarah, are we posting this panel part of the video online?
Yes, we are recording the panel, and people will be able to watch that. In addition, if you missed the movie initially, the movie is going to be available until 9 p.m. so people will be able to catch up. The only thing is, after today, they will not be able to see the movie on Eventive, but they will be able to purchase it on Vimeo.
Okay. Well, thank you all so much for being here. It is, I think always hearing people's stories, hearing, as you said, their lives, and that this is more than a medical condition. These are people's choices. These are people's decisions. These are people's lives. And when it comes to children, it's wonderful that that's part of the joy, and that is part of the journey. So thank you all so much for being here.